Medical Assistant Exam Practice Test. Question 1. While following clinic policy, the medical assistant notes that a radial pulse feels uneven during a rooming assessment. Which measurement is most appropriate to obtain next? Option A. Skip the pulse and document unable to assess. Option B. Use only the patient's reported usual heart rate. Option C. Estimate the pulse for 15 seconds and multiply by 4. Option D. Count the apical pulse for a full minute. The correct answer is option D. Count the apical pulse for a full minute. An irregular rhythm should be assessed for a full minute at the apical site for a more accurate rate. Short estimates, omitted measurements, or patient-reported values do not provide dependable clinical information. Question 2. During a skills check, the scenario states that a patient drank hot coffee immediately before an oral temperature is planned while following standard precautions. Which action should the medical assistant take? Option A. Record the temperature immediately because coffee has no effect. Option B. Ask the patient to sip cold water to balance the reading. Option C. Use the same probe cover for a repeat reading. Option D. Wait before taking the oral temperature or use an approved alternate route. The correct answer is option D. Wait before taking the oral temperature or use an approved alternate route. Hot or cold intake can temporarily alter oral temperature readings, so waiting or using an approved alternate route improves accuracy. Immediate measurement, reused covers, or trying to offset the effect with another drink can create unreliable data and poor infection control. Question 3. After confirming the patient's identity, height and weight have been obtained during an annual physical for a teen patient. What does BMI help screen for? Option A. Weight status in relation to height. Option B. Blood oxygen level during exercise. Option C. Visual acuity at distance. Option D. Kidney filtration rate. The correct answer is option A. Weight status in relation to height. BMI estimates weight status by comparing weight with height and is used as a screening tool rather than a diagnosis by itself. Oxygen saturation, kidney filtration, and vision screening require different measurements and equipment. Question 4. During a skills check, the scenario states that an adult patient is asked to rate pain during intake. Which documentation is most appropriate? Option A. Pain is bad because the patient looks uncomfortable. Option B. Patient probably exaggerates pain. Option C. Pain level of 7 on a 0 to 10 scale with location and quality. Option D. No pain score needed because vital signs are normal. The correct answer is option C. Pain level of 7 on a 0 to 10 scale with location and quality. Pain is subjective and should be documented using the patient's stated rating along with useful details such as location and quality. Judgments, assumptions, and ignoring pain because other vital signs are normal fail to capture the patient's report. Question 5. While following clinic policy, the medical assistant notes that a patient brings several prescription bottles to a visit before documentation is completed. What is the purpose of medication reconciliation? Option A. Record only medications purchased at the clinic. Option B. Compare all current medications to identify omissions, duplications, or interactions. Option C. Replace the provider's medication review. Option D. Throw away medications that look old without asking. The correct answer is option B. Compare all current medications to identify omissions, duplications, or interactions. Medication reconciliation creates an accurate medication list and helps identify potential safety concerns. Discarding medications, replacing the provider's role, or omitting outside prescriptions can create incomplete information. Question 6. In a medical assistant certification review scenario, a new patient begins explaining the main reason for the visit for a patient with limited mobility. Which item should be captured as the chief concern? Option A. The clinic's appointment schedule. Option B. The insurance plan name. Option C. The patient's primary reason for seeking care today. Option D. The brand of exam table used. The correct answer is option C. The patient's primary reason for seeking care today. The chief concern identifies why the patient came for care and guides the visit workflow. Insurance details, equipment information, and the clinic schedule do not describe the patient's presenting problem. Question 7. After confirming the patient's identity, a blood specimen label is about to be placed on a tube. Which action best prevents patient identification errors? Option A. Verify two identifiers such as full name and date of birth before labeling. Option B. Ask another patient to confirm the name. Option C. Label the tube after returning to the desk. Option D. Use the room number as the only identifier. The correct answer is option A. Verify two identifiers such as full name and date of birth before labeling. Two identifiers reduce the risk of assigning results to the wrong patient and should be checked before specimen labeling. Room numbers, delayed labeling, and unrelated confirmation are unsafe because they can lead to misidentification. Question 8. While reviewing office protocol, a tympanic temperature is ordered for an adult patient during a realistic certification question. Which technique is appropriate? Option A. Force the probe deeply into the ear canal. Option B. Position the ear canal according to device instructions before inserting the covered probe. Option C. Use the same technique for every age without adjustment. Option D. Use the probe without a cover to improve contact. The correct answer is option B. Position the ear canal according to device instructions before inserting the covered probe. Tympanic accuracy depends on proper ear canal positioning and a clean probe cover. Uncovered probes, forceful insertion, and ignoring age-specific technique can cause infection risk, discomfort, or inaccurate readings. Question 9. When preparing safe patient care, an adult patient has a respiratory rate of 18 breaths per minute at rest for a returning patient. How should this rate generally be interpreted? Option A. It proves the patient has asthma. Option B. It is always a medical emergency. Option C. It indicates apnea. Option D. It is within the usual adult resting range. The correct answer is option D. It is within the usual adult resting range. A resting adult respiratory rate of 18 per minute generally falls within the expected range. It does not indicate absence of breathing, does not automatically represent an emergency, and cannot diagnose asthma by itself. Question 10. After confirming the patient's identity, a patient names someone to make healthcare decisions if the patient becomes unable. Which role is being assigned? Option A. Insurance coder. Option B. Healthcare proxy or durable power of attorney for healthcare. Option C. Collection agency. Option D. Sterile processing technician. The correct answer is option B. Healthcare proxy or durable power of attorney for healthcare. A healthcare proxy or durable power of attorney for healthcare identifies a decision-maker if the patient loses capacity. Coding, sterilization, and collections are unrelated administrative roles. Question 11. During a follow-up visit, a new patient is involved when gloves are removed after contact with a patient's wound dressing while preventing documentation errors. Which action should follow? Option A. Perform hand hygiene immediately after glove removal. Option B. Touch the keyboard before cleaning hands. Option C. Reuse the gloves for the next patient. Option D. Wash hands only at the end of the shift. The correct answer is option A. Perform hand hygiene immediately after glove removal. Gloves can have tiny defects or contaminate hands during removal, so hand hygiene is required after removal. Reusing gloves, touching shared surfaces first, or delaying hand hygiene increases cross-contamination risk. Question 12. A provider asks for assistance because a used needle has just been removed from a syringe after an injection for a patient who appears anxious. Which action is safest? Option A. Recap it using two hands before disposal. Option B. Carry it uncovered to the front desk. Option C. Drop it in a regular trash can. Option D. Place the sharp immediately into an approved sharps container. The correct answer is option D. Place the sharp immediately into an approved sharps container. Used sharps should go directly into a puncture-resistant sharps container to prevent injury and exposure. Carrying, recapping with two hands, or using regular trash creates avoidable needle stick risk. Question 13. During a follow-up visit, a patient is placed on contact precautions for a draining wound. Which PPE is typically expected when entering for direct care? Option A. Sterile gloves instead of all other PPE. Option B. No PPE because drainage is covered. Option C. Only a surgical mask for every interaction. Option D. Gloves and gown as indicated by the isolation signage. The correct answer is option D. Gloves and gown as indicated by the isolation signage. Contact precautions commonly require gloves and gown for direct contact with the patient or environment. A mask alone, no PPE, or sterile gloves without other indicated protection does not match the purpose of contact precautions. Question 14. A medical assistant reviews a case where a patient has symptoms consistent with influenza while communicating with the care team. Which PPE is commonly used for close contact? Option A. No mask because influenza is not contagious. Option B. A surgical mask with standard precautions. Option C. A lead apron. Option D. Only sterile shoe covers. The correct answer is option B. A surgical mask with standard precautions. Droplet precautions help reduce exposure to respiratory droplets during close contact. Lead aprons, no mask, and sterile shoe covers do not address the main transmission route for influenza-like illness. Question 15. During a morning clinic session, a patient with a routine complaint is involved when a temperature of 101.8 degrees Fahrenheit is obtained during intake for a patient with a routine complaint. How should this finding be handled? Option A. Change it to normal if the patient denies illness. Option B. Record that the patient feels feverish without the value. Option C. Document the measured value as objective data and report it according to office protocol. Option D. Wait until the end of the day to mention it. The correct answer is option C. Document the measured value as objective data and report it according to office protocol. A measured temperature is objective data and should be recorded exactly as obtained. Replacing the value with a vague phrase, delaying a report, or changing the result would make the record inaccurate. Question 16. While assisting with patient care, a new patient is involved when a container holds blood-contaminated disposable materials. Which label or container is appropriate? Option A. An unlabeled cardboard box. Option B. A plain office recycling bin. Option C. A food storage bag. Option D. A biohazard marked container according to facility policy. The correct answer is option D. A biohazard marked container according to facility policy. Blood-contaminated waste requires proper biohazard labeling and disposal to protect staff and waste handlers. Office recycling, food bags, and unlabeled boxes do not communicate exposure risk or meet safe handling expectations. Question 17. During a follow-up visit, a patient who appears anxious is involved when smoke is seen near an electrical outlet in the clinic while prioritizing patient safety. Which action aligns with the RACE fire response sequence? Option A. Open all doors to ventilate smoke. Option B. Rescue patients in immediate danger and activate the alarm according to policy. Option C. Collect insurance cards before leaving. Option D. Ignore the smoke until flames appear. The correct answer is option B. Rescue patients in immediate danger and activate the alarm according to policy. RACE emphasizes rescuing those in danger, activating alarm, containing fire, and extinguishing or evacuating as appropriate. Administrative tasks, opening doors, or ignoring smoke can worsen danger and delay response. Question 18. After confirming the patient's identity, a box of supplies must be lifted from the floor for a patient waiting for the provider. Which technique helps prevent injury? Option A. Twist at the waist while lifting. Option B. Bend at the knees and keep the load close to the body. Option C. Hold the box far away from the body. Option D. Lock the knees and lift with the back. The correct answer is option B. Bend at the knees and keep the load close to the body. Using the legs and keeping the load close reduces strain on the back. Twisting, holding weight away, and lifting with locked knees increase risk of musculoskeletal injury. Question 19. During an annual wellness visit, a patient with a routine complaint is involved when a small blood spill occurs on an exam room floor. Which action should be included? Option A. Ask a visitor to wipe it up. Option B. Wear appropriate PPE and disinfect according to bloodborne pathogen policy. Option C. Cover it with paper and leave it for housekeeping tomorrow. Option D. Clean it with a dry tissue only. The correct answer is option B. Wear appropriate PPE and disinfect according to bloodborne pathogen policy. Blood spills require PPE and approved disinfection because they may contain bloodborne pathogens. Dry wiping, delegating to visitors, or delaying cleanup leaves an exposure hazard. Question 20. While assisting with patient care, a patient is scheduled for an antibiotic injection during a quality control check. Which step is essential before administration? Option A. Ask only whether the patient likes injections. Option B. Ask about allergies and check the record for documented reactions. Option C. Give half the dose without checking. Option D. Assume no allergy if the patient is young. The correct answer is option B. Ask about allergies and check the record for documented reactions. Medication allergies must be assessed before administration because reactions can be serious. Age, arbitrary dose changes, or preferences about injections do not replace allergy verification. Question 21. During a walk-in visit, a patient with limited mobility is involved when multiple tubes including blood cultures are ordered during venipuncture for a patient with limited mobility. Which specimen is collected first in the standard order of draw? Option A, blood cultures. Option B, lavender EDTA tube. Option C, gray fluoride tube. Option D, a red serum tube after all additives. The correct answer is option A, blood cultures. Blood cultures are collected first to reduce contamination risk before additive tubes are drawn. Drawing EDTA, fluoride, or later serum tubes first can interfere with the proper sequence and specimen integrity. Question 22. For a patient scheduled for a procedure in an outpatient setting, a complete blood count is ordered for a patient. Which tube is most appropriate? Option A, lavender EDTA tube. Option B, light blue citrate tube. Option C, plain urine cup. Option D, gray fluoride tube. The correct answer is option A, lavender EDTA tube. Lavender tubes contain EDTA, which preserves blood cells for hematology testing such as a complete blood count. Citrate, fluoride, and urine containers do not provide the correct specimen type for a CBC. Question 23. At the start of a same-day appointment, a patient asking for clarification is involved when a chemistry test requires serum rather than whole blood while preparing for provider review. Which specimen type is needed? Option A, blood allowed to clot before serum is separated. Option B, blood mixed continuously with EDTA. Option C, a throat swab placed in urine preservative. Option D, a finger stick smear without clotting. The correct answer is option A, blood allowed to clot before serum is separated. Serum is the liquid portion obtained after blood clots and is separated from the clot. EDTA whole blood, incorrect swab handling, and an unprocessed finger stick smear do not provide serum. Question 24. In a medical assistant certification review scenario, venipuncture is being performed in the antecubital area for an adult patient. Which insertion technique is generally appropriate? Option A, insert the needle bevel up at about a 15 to 30 degree angle. Option B, insert through the vein and redirect repeatedly. Option C, insert parallel under the skin for several inches. Option D, insert bevel down at a 90 degree angle. The correct answer is option A, insert the needle bevel up at about a 15 to 30 degree angle. A bevel up 15 to 30 degree approach helps enter the vein safely during routine venipuncture. Steep angles, long shallow tunneling, and repeated redirection increase discomfort and complication risk. Question 25. A medical assistant reviews a case where an infant arrives for a well-child visit. Which measurement is commonly documented in addition to weight and length? Option A, peak flow only. Option B, head circumference. Option C, waist to hip ratio. Option D, Snellen distance score. The correct answer is option B, head circumference. Head circumference is an important growth measurement for infants and helps monitor development over time. Waist ratios, peak flow values, and Snellen scores are not routine substitutes for infant growth tracking. Question 26. During a skills check, the scenario states that a patient scheduled for a fasting lipid panel says they ate breakfast during the visit. Which action is best? Option A, collect and label it fasting anyway. Option B, tell the patient to skip water for the rest of the day. Option C, follow facility policy and notify the provider or lab before collecting if fasting is required. Option D, cancel all future appointments. The correct answer is option C, follow facility policy and notify the provider or lab before collecting if fasting is required. A fasting requirement affects interpretation, so the situation should be handled according to policy before collection. Labeling a non-fasting specimen as fasting, giving unsafe instructions, or canceling unrelated care is inappropriate. Question 27. During a skills check, the scenario states that a urine culture is ordered for a patient with possible infection for a new patient. Which instruction is appropriate? Option A, clean the area and collect a midstream specimen in the sterile container. Option B, fill the container with water before collecting urine. Option C, touch the inside of the lid to keep it nearby. Option D, collect from the toilet bowl after voiding. The correct answer is option A, clean the area and collect a midstream specimen in the sterile container. A clean catch midstream technique reduces contamination for culture results. Touching sterile surfaces, collecting from the toilet, or adding water can contaminate or dilute the specimen. Question 28. After confirming the patient's identity, a point-of-care test control result is outside the acceptable range. Which action should occur before testing patients? Option A, continue testing because controls are optional. Option B, do not report patient results until the control problem is resolved. Option C, change patient results to match expectations. Option D, throw away the control log. The correct answer is option B, do not report patient results until the control problem is resolved. Out-of-range controls indicate the test system may not be reliable, so patient testing should pause until corrected. Ignoring controls, altering results, or discarding records undermines patient safety and compliance. Question 29. During a skills check, the scenario states that a urine specimen cannot be tested promptly while preparing for provider review. Which action preserves specimen quality according to policy? Option A, refrigerate or preserve it if testing is delayed beyond the allowed time. Option B, leave it uncapped at room temperature all day. Option C, place it near a sunny window to keep warm. Option D, mix it with another patient's specimen. The correct answer is option A, refrigerate or preserve it if testing is delayed beyond the allowed time. Delayed urine testing can allow bacterial growth or chemical changes, so refrigeration or preservatives may be required. Leaving it uncapped, warming it, or mixing specimens compromises results and patient identification. Question 30. A medical assistant reviews a case where a vaccine vial is selected from storage for an older adult. Which check must be performed before administration? Option A, ignore storage logs if the patient is waiting. Option B, use it if the label color looks familiar. Option C, confirm the expiration date and storage conditions. Option D, warm it on a windowsill for the day. The correct answer is option C, confirm the expiration date and storage conditions. Expiration date and storage conditions affect medication safety and effectiveness. Label familiarity, warming on a windowsill, or ignoring logs can lead to administering an unusable product. Question 31. While following clinic policy, the medical assistant notes that specimens need to be spun in a centrifuge. Which safety step is required? Option A, open the lid while the rotor is moving. Option B, place tubes at random angles. Option C, spin a single tube alone for faster results. Option D, balance tubes of similar size and volume across from each other. The correct answer is option D, balance tubes of similar size and volume across from each other. Balancing the centrifuge prevents vibration, tube breakage, and equipment damage. Spinning unbalanced loads, opening the lid during motion, or random placement creates safety and specimen risks. Question 32. While following clinic policy, the medical assistant notes that blood cultures are being collected while working under provider supervision. Which step is especially important? Option A, draw through visibly dirty skin. Option B, use proper skin antisepsis and avoid contaminating the cleaned site. Option C, palpate the site again with an unclean glove after cleaning. Option D, skip antisepsis because culture bottles contain additives. The correct answer is option B, use proper skin antisepsis and avoid contaminating the cleaned site. Blood cultures are highly sensitive to contamination, so skin antisepsis and maintaining the cleaned field are critical. Touching the site again, skipping antisepsis, or drawing through dirty skin can cause false positive results. Question 33. In a medical assistant certification review scenario, a labeled blood specimen is being sent to the laboratory for a patient in the exam room. Which packaging is appropriate? Option A, carry it open in a coat pocket. Option B, put it loose in the regular mail bin. Option C, place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. Option D, tape it to the outside of the requisition. The correct answer is option C. Place the specimen in a leak-resistant biohazard transport bag with paperwork separated as required. Biohazard transport bags help contain leaks and keep paperwork protected from contamination. Pockets, taped tubes, and loose mail-bin transport create exposure and specimen handling risks. Question 34. For a patient with diabetes in an outpatient setting, a 12-lead EKG is being set up. Where is lead V1 placed? Option A, fourth intercostal space at the right sternal border. Option B, second intercostal space at the left midclavicular line. Option C, on the right wrist beside the limb lead. Option D, fifth intercostal space at the left anterior axillary line. The correct answer is option A, fourth intercostal space at the right sternal border. V1 is placed at the fourth intercostal space on the right sternal border. The other locations correspond to different chest or limb areas and would distort the tracing if used for V1. Question 35. While following clinic policy, the medical assistant notes that adult CPR is started according to current basic life support guidance before the patient leaves the clinic. Which compression rate is commonly taught? Option A, 100 to 120 compressions per minute. Option B, 250 to 300 compressions per minute. Option C, 1 compression every 5 minutes. Option D, 10 to 20 compressions per minute. The correct answer is option A, 100 to 120 compressions per minute. Adult CPR training commonly teaches a compression rate of 100 to 120 per minute. Very slow, extremely fast, or occasional compressions do not provide effective circulation support. Question 36. A medical assistant reviews a case where an EKG tracing has wandering baseline and one electrode is peeling away for a patient who appears anxious. Which action is best? Option A, leave the electrode loose to avoid discomfort. Option B, reattach or replace the loose electrode after preparing the skin. Option C, write normal on the tracing without review. Option D, tell the patient the heart rhythm is definitely abnormal. The correct answer is option B, reattach or replace the loose electrode after preparing the skin. A loose electrode can cause baseline wander or signal loss, so correcting the connection is appropriate. Diagnosing the rhythm, leaving the problem, or labeling the tracing without review is outside proper procedure. Question 37. During a geriatric visit, a patient with limited mobility is involved when a patient is going home with a Holter monitor. Which instruction is important? Option A, remove the electrodes whenever symptoms occur. Option B, keep a diary of symptoms and activities during monitoring. Option C, avoid writing down chest discomfort. Option D, take a shower with the monitor unless told otherwise. The correct answer is option B, keep a diary of symptoms and activities during monitoring. A symptom and activity diary helps correlate patient experiences with recorded heart rhythm data. Removing electrodes, getting the device wet against instructions, or failing to note symptoms reduces the usefulness of the test. Question 38. A provider asks for assistance because a regular EKG rhythm has 4 large boxes between our waves during a high-yield exam review. Which approximate heart rate is calculated using the 300 method? Option A, 40 beats per minute. Option B, 120 beats per minute. Option C, 300 beats per minute. Option D, 75 beats per minute. The correct answer is option D, 75 beats per minute. For a regular rhythm, dividing 300 by the number of large boxes gives an estimate, so 300 divided by 4 equals 75. The other values do not match the 300 method for 4 large boxes. Question 39. When preparing safe patient care, a 12-lead EKG requires limb electrodes for an adult patient. Which label belongs on the right arm area? Option A, LL. Option B, RA. Option C, V4. Option D, LA. The correct answer is option B, RA. RA identifies the right arm limb electrode location. LA and LL refer to other limb leads, while V4 is a chest lead rather than a right arm label. Question 40. A medical assistant reviews a case where a point-of-care glucose test is about to be performed. Which supply check is needed? Option A, cut the strip in half to save supplies. Option B, use any strip from an unlabeled container. Option C, confirm the test strips are not expired and are stored correctly. Option D, wet the strip before inserting it. The correct answer is option C, Confirm the test strips are not expired and are stored correctly. Expired or improperly stored strips may produce inaccurate glucose results. Unlabeled strips, wetting strips, or altering strip size violates testing procedure and quality standards. Question 41. In a medical assistant certification review scenario, a patient preparing for a cardiac stress test asks what symptoms to report after confirming office policy. Which symptom should be reported immediately? Option A, chest pain, severe shortness of breath, dizziness, or feeling faint. Option B, preference for a different magazine. Option C, hunger after skipping breakfast. Option D, mild boredom with waiting. The correct answer is option A. Chest pain, severe shortness of breath, dizziness, or feeling faint. Chest pain, severe dyspnea, dizziness, and faintness can signal serious exercise intolerance or cardiac stress. Boredom, reading preferences, and routine hunger may be addressed but are not the urgent stress test warning symptoms. Question 42. When preparing safe patient care, a patient is scheduled for an antibiotic injection for a returning patient. Which step is essential before administration? Option A. Ask only whether the patient likes injections. Option B. Assume no allergy if the patient is young. Option C. Ask about allergies and check the record for documented reactions. Option D. Give half the dose without checking. The correct answer is option C. Ask about allergies and check the record for documented reactions. Medication allergies must be assessed before administration because reactions can be serious. Age, arbitrary dose changes, or preferences about injections do not replace allergy verification. Question 43. For a teen patient in an outpatient setting, a medication is ordered by the subcutaneous route. Where is the medication intended to be placed? Option A, into the outer layer of bone. Option B, into the fatty tissue beneath the skin. Option C, directly into a vein. Option D, into the spinal canal. The correct answer is option B, into the fatty tissue beneath the skin. Subcutaneous injections deliver medication into the tissue layer beneath the skin and above muscle. Intravenous, bone, and spinal routes are different procedures with different risks and training requirements. Question 44. In a busy family practice clinic, a patient brings several prescription bottles to a visit during the visit. What is the purpose of medication reconciliation? Option A, replace the provider's medication review. Option B, throw away medications that look old without asking. Option C, record only medications purchased at the clinic. Option D, compare all current medications to identify omissions, duplications, or interactions. The correct answer is option D. Compare all current medications to identify omissions, duplications, or interactions. Medication reconciliation creates an accurate medication list and helps identify potential safety concerns. Discarding medications, replacing the provider's role, or omitting outside prescriptions can create incomplete information. Question 45. During a skills check, the scenario states that a patient is pale, cool, clammy, and confused after an injury for a patient with hypertension. Which condition is a concern? Option A, shock. Option B, myopia. Option C, otitis externa. Option D, acne. The correct answer is option A, shock. Pale, cool skin, clamminess, and confusion after injury can indicate shock and require urgent response. Nearsightedness, ear canal infection, and acne do not explain this emergency pattern. Question 46. In a medical assistant certification review scenario, a medication list includes atorvastatin. Which medication class does this represent? Option A, statin used to lower cholesterol. Option B, diuretic used to increase urine output. Option C, anticoagulant used to dissolve clots instantly. Option D, a bronchodilator used for acute wheezing only. The correct answer is option A, statin used to lower cholesterol. Atorvastatin is a statin used to help manage cholesterol levels. Diuretics, anticoagulants, and bronchodilators have different purposes and mechanisms. Question 47. For a patient with limited mobility in an outpatient setting, a patient uses an albuterol inhaler for wheezing while checking the chart. What is the intended effect? Option A, destroy bacteria in the stomach. Option B, increase blood clotting. Option C, relax airway smooth muscle to improve airflow. Option D, lower cholesterol over months. The correct answer is option C. Relax airway smooth muscle to improve airflow. Albuterol is a bronchodilator that opens airways and can relieve bronchospasm. Blood clotting, cholesterol control, and bacterial destruction are unrelated medication effects. Question 48. When preparing safe patient care, a controlled medication is stored in the clinic for an adult patient. Which practice supports accountability? Option A, keep it unlocked for convenience. Option B, document receipt, administration, waste, and remaining count according to policy. Option C, let patients sign it out themselves. Option D, estimate the count once a year. The correct answer is option B. Document receipt, administration, waste, and remaining count according to policy. Controlled substances require strict documentation and secure handling to prevent diversion and errors. Unlocked storage, infrequent estimates, or patient self-checkout would break accountability requirements. Question 49. During a skills check, the scenario states that a patient takes several products for cold symptoms and pain. Which concern should be reviewed with acetaminophen? Option A. It always causes bacterial resistance. Option B. Accidental duplicate dosing can increase liver injury risk. Option C. It replaces all vaccines. Option D. It should be taken only by injection. The correct answer is option B. Accidental duplicate dosing can increase liver injury risk. Many over-the-counter products contain acetaminophen, so duplicate dosing can exceed safe daily limits and harm the liver. It does not cause antibiotic resistance, replace vaccines, or require injection use. Question 50. A provider asks for assistance because a medication note refers to hypotension during a realistic certification question. What does hypo mean? Option A. Above normal. Option B. Between ribs. Option C. Before birth. Option D. Below normal or low. The correct answer is option D. Below normal or low. Hypo means low or below normal, so hypotension means low blood pressure. Above normal, between ribs, and before birth use different prefixes. Question 51. During a skills check, the scenario states that a vaccine vial is selected from storage for a patient with hypertension. Which check must be performed before administration? Option A. Warm it on a windowsill for the day. Option B. Ignore storage logs if the patient is waiting. Option C. Use it if the label color looks familiar. Option D. Confirm the expiration date and storage conditions. The correct answer is option D. Confirm the expiration date and storage conditions. Expiration date and storage conditions affect medication safety and effectiveness. Label familiarity, warming on a windowsill, or ignoring logs can lead to administering an unusable product. Question 52. In a busy family practice clinic, a term contains the combining form cardi/o. Which body structure is referenced? Option A. Kidney. Option B. Stomach. Option C. Heart. Option D. Skin. The correct answer is option C. Heart. Cardi/o refers to the heart and appears in terms such as cardiology and cardiogram. Kidney, stomach, and skin use different word parts. Question 53. A medical assistant reviews a case where a pulse rate is documented as tachycardic while checking the chart. Which finding is being described? Option A. Low body temperature. Option B. Faster than normal heart rate. Option C. Inflammation of the stomach. Option D. Slow breathing only. The correct answer is option B. Faster than normal heart rate. Tachycardia describes an abnormally fast heart rate for the patient's situation. Low temperature, slow respirations, and stomach inflammation are different concepts. Question 54. During a skills check, the scenario states that a diabetic patient is shaky, sweating, and confused before lunch for a returning patient. Which condition should be considered? Option A. Hyperopia. Option B. Dermatitis only. Option C. Hypoglycemia. Option D. Otitis media. The correct answer is option C. Hypoglycemia. Shaking, sweating, and confusion can occur with low blood glucose, especially when meals are delayed. Vision farsightedness, middle ear infection, and skin inflammation do not best match this symptom pattern. Question 55. In a medical assistant certification review scenario, a clinic performs a rapid strep test classified as waived. What does waived testing generally mean? Option A. Only a physician may read the result in every setting. Option B. The test is simple and has a low risk of erroneous results when performed correctly. Option C. The test never needs quality control. Option D. The result cannot be documented in the chart. The correct answer is option B. The test is simple and has a low risk of erroneous results when performed correctly. CLIA waived tests are considered simple with low risk when instructions are followed, but quality procedures still matter. Waived status does not remove documentation, training, or quality control responsibilities. Question 56. While following clinic policy, the medical assistant notes that a patient asks what the kidneys do while following standard precautions. Which response is accurate? Option A. Produce bile for fat digestion. Option B. Filter waste from blood and help regulate fluid balance. Option C. Exchange oxygen in the alveoli. Option D. Pump blood through arteries. The correct answer is option B. Filter waste from blood and help regulate fluid balance. The kidneys filter blood, form urine, and help regulate fluid and electrolyte balance. Bile production, gas exchange, and blood pumping are liver, lung, and heart functions. Question 57. A provider asks for assistance because a study question asks about bile production for a patient in the exam room. Which organ is primarily responsible? Option A. Liver. Option B. Appendix. Option C. The adrenal gland. Option D. Bladder. The correct answer is option A. Liver. The liver produces bile, which helps with fat digestion after storage and release through the biliary system. The appendix, bladder, and adrenal gland have different roles. Question 58. While preparing the exam room, a medication note refers to hypotension. What does hypo mean? Option A. Before birth. Option B. Below normal or low. Option C. Above normal. Option D. Between ribs. The correct answer is option B. Below normal or low. Hypo means low or below normal, so hypotension means low blood pressure. Above normal, between ribs, and before birth use different prefixes. Question 59. While following clinic policy, the medical assistant notes that a patient describes dysuria before documentation is completed. What does dys usually indicate? Option A. Difficult or painful. Option B. Normal. Option C. After meals. Option D. Without. The correct answer is option A. Difficult or painful. Dys often means difficult, painful, or abnormal, so dysuria is painful or difficult urination. Normal, without, and after meals are represented by different word parts. Question 60. When preparing safe patient care, a patient in the waiting room reports crushing chest pain and sweating for a pediatric patient. Which action should the medical assistant take? Option A. Offer billing forms before alerting anyone. Option B. Tell the patient to drive home and sleep. Option C. Ask the patient to wait until the next available routine slot. Option D. Activate the office emergency protocol and notify the provider immediately. The correct answer is option D. Activate the office emergency protocol and notify the provider immediately. Crushing chest pain with sweating may indicate a medical emergency and requires immediate escalation. Waiting, advising the patient to drive, or focusing on paperwork delays care. Question 61. At the front desk handoff, an anatomy diagram divides the body into left and right portions. Which plane is shown? Option A. Transverse plane. Option B. Frontal plane. Option C. Sagittal plane. Option D. The oblique medication route. The correct answer is option C. Sagittal plane. The sagittal plane divides the body into left and right portions. Transverse divides upper and lower. Frontal divides front and back. And oblique medication route is not an anatomical plane. Question 62. After confirming the patient's identity, a patient is lying face down on the exam table after the patient asks a follow-up question. Which term describes this position? Option A. Trendelenburg. Option B. Prone. Option C. Supine. Option D. Fowler. The correct answer is option B. Prone. Prone means lying face down. Supine is face up. Fowler is seated with the head elevated, and Trendelenburg positions the head lower than the feet. Question 63. When preparing safe patient care, a patient has fatigue, cold intolerance, and weight gain with low thyroid activity for a pediatric patient. Which condition is suggested? Option A, tachycardia only. Option B, otitis media. Option C, hyperventilation. Option D, hypothyroidism. The correct answer is option D, hypothyroidism. Hypothyroidism reflects reduced thyroid hormone activity and can slow metabolism. Hyperventilation, middle ear infection, and fast heart rate do not match the low thyroid pattern described. Question 64. A provider asks for assistance because a patient has swelling in the ankles from excess fluid in tissues. Which term applies? Option A, edema. Option B, diplopia. Option C, hematuria. Option D, cyanosis. The correct answer is option A, edema. Edema is swelling caused by fluid accumulation in tissues. Cyanosis, hematuria, and diplopia refer to bluish discoloration, blood in urine, and double vision. Question 65. A provider asks for assistance because orthostatic hypotension is suspected after a patient reports dizziness when standing while preparing for provider review. Which approach is appropriate? Option A, measure temperature in 3 routes. Option B, measure blood pressure and pulse after position changes according to protocol. Option C, take only a single seated blood pressure. Option D, ask the patient to jog briefly before measuring. The correct answer is option B, measure blood pressure and pulse after position changes according to protocol. Orthostatic assessment compares blood pressure and pulse across position changes to evaluate a possible drop with standing. A single seated reading, exertion before measurement, or unrelated temperature checks does not assess the suspected problem. Question 66. A medical assistant reviews a case where a patient's insurance requires approval to see a specialist for a patient in the exam room. Which document or process may be needed? Option A, medication lot sticker. Option B, autoclave log only. Option C, referral. Option D, inventory count sheet. The correct answer is option C, referral. A referral authorizes or documents the need for specialty care under many insurance plans. Inventory sheets, sterilization logs, and lot stickers do not authorize specialty visits. Question 67. In a medical assistant certification review scenario, a patient pays a fixed amount at each office visit under the insurance plan. Which term describes this payment? Option A, deductible only. Option B, premium refund. Option C, copayment. Option D, relative value unit. The correct answer is option C, copayment. A copayment is a fixed patient payment due for a covered service. A deductible, premium refund, and relative value unit describe other financial or coding concepts. Question 68. In a medical assistant certification review scenario, an insurance plan pays 80% and the patient is responsible for 20% after the deductible before documentation is completed. Which term describes the patient portion? Option A, chief complaint. Option B, coinsurance. Option C, capitation only. Option D, sterilization. The correct answer is option B, coinsurance. Coinsurance is a percentage share of allowed costs paid by the patient. Chief complaint, capitation, and sterilization describe different clinical or payment concepts. Question 69. For a patient in the exam room in an outpatient setting, a claim needs a code for an office procedure performed by the provider for a patient in the exam room. Which code set is commonly used? Option A, CPT. Option B, ICD-10-CM. Option C, Advanced Directive. Option D, alphabetic filing. The correct answer is option A, CPT. CPT codes describe medical procedures and services for billing. ICD-10-CM diagnoses, filing systems, and advanced directives do not code the service performed. Question 70. While following clinic policy, the medical assistant notes that a dressing change is being performed on a draining wound. Which action is appropriate? Option A, document the wound before assessing it. Option B, reuse old tape to save supplies. Option C, place soiled dressings on the clean supply tray. Option D, use clean or sterile technique as ordered and dispose of soiled dressings properly. The correct answer is option D, use clean or sterile technique as ordered and dispose of soiled dressings properly. Dressing changes require technique appropriate to the order and safe disposal of contaminated materials. Placing soiled items with clean supplies, reusing tape, or documenting before assessment can create infection and accuracy problems. Question 71. While reviewing office protocol, Medicare may not cover a service and the patient must be informed before it is performed after noticing a potential safety concern. Which form may be needed? Option A, Advance Beneficiary Notice. Option B, Daily Appointment Reminder Card. Option C, Bloodborne Pathogen Log. Option D, Pediatric Growth Chart. The correct answer is option A, Advance Beneficiary Notice. An advance beneficiary notice informs a Medicare patient that a service may not be covered and that they may be financially responsible. Exposure logs, growth charts, and reminder cards do not serve this financial notice purpose. Question 72. For an older adult in an outpatient setting, a patient wants lab results through an online system for an older adult. Which feature supports secure access? Option A, a public social media comment. Option B, a hallway bulletin board. Option C, a group text to unrelated patients. Option D, a patient portal with identity verification and secure messaging. The correct answer is option D, a patient portal with identity verification and secure messaging. A patient portal is designed to give patients secure access to health information and communication. Social posts, bulletin boards, and unrelated group texts expose protected information. Question 73. While following clinic policy, the medical assistant notes that the provider blocks lunch, meetings, and procedure times before booking patients. Which scheduling method is being used? Option A, random scheduling. Option B, matrix scheduling. Option C, sterile scheduling only. Option D, biohazard scheduling. The correct answer is option B, matrix scheduling. Matrix scheduling blocks unavailable or reserved times so appointments are not placed there. Random, biohazard, and sterile scheduling are not standard appointment scheduling methods. Question 74. After confirming the patient's identity, two patients are placed in the same appointment slot after confirming office policy. What is this called? Option A, downcoding only. Option B, double booking. Option C, closed filing. Option D, capillary puncture. The correct answer is option B, double booking. Double booking schedules more than one patient in the same time slot and should be used carefully according to policy. Capillary puncture, filing, and downcoding are unrelated terms. Question 75. While following clinic policy, the medical assistant notes that a claim includes durable medical equipment supplied to a patient for a patient waiting for the provider. Which code set may be used? Option A, only the patient's zip code. Option B, the provider's lunch schedule. Option C, HCPCS Level 2. Option D, a pain rating scale. The correct answer is option C, HCPCS Level 2. HCPCS Level 2 codes are commonly used for supplies, equipment, and some services not fully described by CPT. Zip codes, schedules, and pain scales are not coding systems for durable medical equipment. Question 76. When preparing safe patient care, a patient leaves a medication question by phone. Which information should be documented? Option A, no documentation unless the patient complains. Option B, the assistant's lunch preference. Option C, only the caller's tone of voice. Option D, date, time, caller identity, message details, and action taken. The correct answer is option D, date, time, caller identity, message details, and action taken. Complete telephone documentation creates a clear record of the request and response. Tone alone, irrelevant personal details, or no documentation can lead to missed care and poor continuity. Question 77. While reviewing office protocol, a patient asks the medical assistant to diagnose a rash while maintaining privacy. Which response is appropriate? Option A, prescribe a topical steroid. Option B, explain that the provider will evaluate the rash and document the patient's concern. Option C, tell the patient no evaluation is needed. Option D, diagnose the rash as cancer. The correct answer is option B, explain that the provider will evaluate the rash and document the patient's concern. Medical assistants collect information and assist with care but do not diagnose or prescribe. Giving a diagnosis, ordering treatment independently, or dismissing the concern exceeds appropriate scope. Question 78. During a skills check, the scenario states that a competent adult refuses a recommended injection for a patient with diabetes. Which action is appropriate? Option A, force the injection because it was ordered. Option B, hide the syringe in another medication. Option C, delete the order without telling anyone. Option D, notify the provider and document the refusal according to policy. The correct answer is option D, notify the provider and document the refusal according to policy. Competent patients generally have the right to refuse care, and the refusal should be communicated and documented. Force, deception, or unauthorized deletion violates autonomy and safe practice. Question 79. A medical assistant reviews a case where a staff member fails to follow a safety policy and a patient is injured as a result. Which concept is involved? Option A, autoclaving. Option B, coinsurance. Option C, therapeutic communication only. Option D, negligence. The correct answer is option D, negligence. Negligence involves a breach of duty that contributes to harm. Sterilization, cost sharing, and communication skills are different concepts and do not describe the legal breach by themselves. Question 80. A provider asks for assistance because a tympanic temperature is ordered for an adult patient while prioritizing patient safety. Which technique is appropriate? Option A, force the probe deeply into the ear canal. Option B, use the same technique for every age without adjustment. Option C, use the probe without a cover to improve contact. Option D, position the ear canal according to device instructions before inserting the covered probe. The correct answer is option D, position the ear canal according to device instructions before inserting the covered probe. Tympanic accuracy depends on proper ear canal positioning and a clean probe cover. Uncovered probes, forceful insertion, and ignoring age-specific technique can cause infection risk, discomfort, or inaccurate readings. Question 81. For a teen patient in an outpatient setting, a patient names someone to make healthcare decisions if the patient becomes unable for a teen patient. Which role is being assigned? Option A, collection agency. Option B, healthcare proxy or durable power of attorney for healthcare. Option C, insurance coder. Option D, sterile processing technician. The correct answer is option B, healthcare proxy or durable power of attorney for healthcare. A healthcare proxy or durable power of attorney for healthcare identifies a decision-maker if the patient loses capacity. Coding, sterilization, and collections are unrelated administrative roles. Question 82. When preparing safe patient care, a patient receives new wound care instructions. Which method checks understanding? Option A, assumes silence means full understanding. Option B, ask only whether the patient owns a phone. Option C, ask the patient to explain the steps in their own words. Option D, give instructions as quickly as possible and leave. The correct answer is option C, ask the patient to explain the steps in their own words. Teach back confirms understanding by having the patient describe the instructions. Phone ownership, rushed teaching, and silence do not verify that the patient can follow the plan. Question 83. At a new patient intake, a medical assistant wants to learn more about a symptom timeline before the patient leaves the clinic. Which prompt encourages a fuller answer? Option A, tell me when you first noticed the symptom and how it has changed. Option B, it started yesterday, right? Option C, you are fine now, correct? Option D, do not talk about the symptom. The correct answer is option A, tell me when you first noticed the symptom and how it has changed. Open-ended prompts let the patient provide a narrative and timeline in their own words. Leading or dismissive statements restrict the information and can bias the history. Question 84. A medical assistant reviews a case where a patient with limited English proficiency needs discharge teaching for a patient in the exam room. Which approach is best? Option A, ask a young child to interpret sensitive information. Option B, skip teaching because interpretation takes time. Option C, use a qualified medical interpreter according to policy. Option D, speak louder in English only. The correct answer is option C, use a qualified medical interpreter according to policy. Qualified interpreters improve accuracy, confidentiality, and patient understanding. Children, louder speech, or skipped teaching can cause errors and ethical concerns. Question 85. For a patient who appears anxious in an outpatient setting, a patient asks whether to stop an antibiotic once symptoms improve. Which instruction is generally appropriate? Option A, stop immediately when feeling better every time. Option B, save the rest for a family member. Option C, follow the prescribed course and contact the provider before stopping early. Option D, double the next dose to finish faster. The correct answer is option C. Follow the prescribed course and contact the provider before stopping early. Antibiotics should be taken as prescribed unless the provider changes the plan, which helps treatment success and stewardship. Stopping early, sharing medication, or doubling doses can be unsafe and ineffective. Question 86. In a medical assistant certification review scenario, a medical assistant acts to promote the patient's welfare while following standard precautions. Which ethical principle is demonstrated? Option A, fraud. Option B, a maleficence. Option C, deposition. Option D, beneficence. The correct answer is option D, beneficence. Beneficence means acting for the benefit and welfare of the patient. Maleficence, fraud, and deposition describe harm, deception, or legal testimony rather than doing good. Question 87. When preparing safe patient care, a patient chooses between treatment options after receiving information for an older adult. Which ethical principle is being respected? Option A, coinsurance. Option B, artifact. Option C, autonomy. Option D, sterility. The correct answer is option C, autonomy. Autonomy supports the patient's right to make informed decisions about care. Sterility, coinsurance, and artifact refer to infection control, insurance, and test quality issues. Question 88. After confirming the patient's identity, an unconscious patient needs emergency care and no surrogate is available. Which consent concept may apply? Option A, implied consent. Option B, alphabetic consent. Option C, express written refusal. Option D, routine copayment consent. The correct answer is option A, implied consent. Implied consent may apply in emergencies when a patient cannot consent and urgent care is necessary. Written refusal, payment consent, and alphabetic consent do not describe this emergency concept. Question 89. In a medical assistant certification review scenario, a patient in the waiting room reports crushing chest pain and sweating during a realistic certification question. Which action should the medical assistant take? Option A, ask the patient to wait until the next available routine slot. Option B, activate the office emergency protocol and notify the provider immediately. Option C, offer billing forms before alerting anyone. Option D, tell the patient to drive home and sleep. The correct answer is option B, activate the office emergency protocol and notify the provider immediately. Crushing chest pain with sweating may indicate a medical emergency and requires immediate escalation. Waiting, advising the patient to drive, or focusing on paperwork delays care. Question 90. When preparing safe patient care, a pulse oximeter is not giving a steady reading on a patient with cold fingers for a patient who appears anxious. Which action should the medical assistant try first? Option A, place the probe on a moving hand during conversation. Option B, ignore the reading because pulse oximetry is optional. Option C, warm the finger and ensure the sensor is positioned correctly. Option D, apply the sensor over dark nail polish without adjustment. The correct answer is option C, warm the finger and ensure the sensor is positioned correctly. Cold extremities and poor sensor placement can interfere with pulse oximeter detection. Nail polish, movement, and ignoring an unstable reading can all lead to inaccurate oxygen saturation documentation. Question 91. When preparing safe patient care, a patient develops wheezing and facial swelling after a medication. Which response is appropriate? Option A, offer a glass of water only. Option B, activate emergency protocol and prepare to assist with ordered epinephrine. Option C, tell the patient to ignore throat symptoms. Option D, schedule a routine follow-up in 6 months. The correct answer is option B, activate emergency protocol and prepare to assist with ordered epinephrine. Wheezing and facial swelling after medication can indicate anaphylaxis, requiring rapid emergency response. Routine scheduling, ignoring airway symptoms, or offering water alone delays potentially life-saving care. Question 92. For a patient with limited mobility in an outpatient setting, a patient has a minor thermal burn from touching hot equipment while communicating with the care team. Which first aid action is appropriate? Option A, break blisters to release fluid. Option B, apply ice directly for a long time. Option C, cool the area with cool running water according to protocol. Option D, rub butter into the burn. The correct answer is option C, cool the area with cool running water according to protocol. Cooling a minor burn with cool running water can limit tissue damage and reduce pain. Direct prolonged ice, butter, or breaking blisters can damage tissue or increase infection risk. Question 93. In a medical assistant certification review scenario, a patient suddenly has facial drooping and arm weakness for a pediatric patient. Which emergency condition should be suspected? Option A, stroke. Option B, seasonal allergies only. Option C, simple paperwork fatigue. Option D, routine nearsightedness. The correct answer is option A, stroke. Facial drooping and arm weakness are warning signs captured by FAST for possible stroke. Allergies, vision issues, and paperwork fatigue do not match sudden focal neurologic deficits. Question 94. A provider asks for assistance because adult CPR is started according to current basic life support guidance. Which compression rate is commonly taught? Option A, 10 to 20 compressions per minute. Option B, 250 to 300 compressions per minute. Option C, 1 compression every 5 minutes. Option D, 100 to 120 compressions per minute. The correct answer is option D, 100 to 120 compressions per minute. Adult CPR training commonly teaches a compression rate of 100 to 120 per minute. Very slow, extremely fast, or occasional compressions do not provide effective circulation support. Question 95. A medical assistant reviews a case where a patient has written instructions about future medical care if unable to speak during a high-yield exam review. Which document is this? Option A, daily deposit slip. Option B, autoclave indicator. Option C, superbill. Option D, advance directive. The correct answer is option D, advance directive. An advance directive communicates care preferences for future situations when the patient may be unable to decide. Billing, sterilization, and deposit documents do not express medical wishes. Question 96. After confirming the patient's identity, a patient falls in the hallway and says their hip hurts for a patient who appears anxious. Which action is appropriate? Option A, tell the patient to walk it off. Option B, lift the patient quickly without assessment. Option C, keep the patient still, call for help, and follow incident protocol. Option D, delete the event if no one saw it. The correct answer is option C, keep the patient still, call for help, and follow incident protocol. After a fall with pain, the patient should not be moved unnecessarily until assessed and help arrives. Rapid lifting, dismissing the injury, or hiding the event can worsen harm and violate reporting procedures. Question 97. For a patient scheduled for a procedure in an outpatient setting, a patient is scheduled for a minor office procedure. Which role may the medical assistant perform? Option A, perform the procedure without provider involvement. Option B, witness the patient's signature after the provider obtains consent if office policy allows. Option C, explain all surgical risks independently. Option D, sign the consent for the patient. The correct answer is option B, witness the patient's signature after the provider obtains consent if office policy allows. Medical assistants may witness signatures according to policy, but the provider explains risks and obtains informed consent. Independent risk counseling, unsupervised procedures, or signing for the patient exceeds the role. Question 98. A medical assistant reviews a case where a provider asks the medical assistant to prepare for suture removal during a high-yield exam review. Which supply is commonly needed? Option A, a meal tray. Option B, a blood pressure cuff only. Option C, sterile suture removal scissors or a sterile blade with forceps according to policy. Option D, a urine culture cup only. The correct answer is option C, sterile suture removal scissors or a sterile blade with forceps according to policy. Suture removal uses appropriate sterile instruments and infection control technique. A cuff, urine cup, or meal tray does not remove sutures safely. Question 99. In a medical assistant certification review scenario, a patient has a small foreign material exposure in the eye for a pediatric patient. Which action is appropriate before irrigation? Option A, apply random medication drops without order. Option B, check the order or protocol and use appropriate solution and protection. Option C, use a dry cotton swab across the cornea. Option D, ignore contact lenses and begin forcefully. The correct answer is option B. Check the order or protocol and use appropriate solution and protection. Eye irrigation should follow protocol with correct solution and care to prevent injury. Dry swabbing, unadhered medication, or forceful technique can damage the eye. Question 100. During a follow-up visit, a patient uses a medication patch. Which instruction is important when applying a new patch? Option A, apply every patch in the same irritated spot. Option B, cover the patch with a heating pad. Option C, cut all patches to adjust the dose. Option D, remove the old patch before applying the new one if directed. The correct answer is option D. Remove the old patch before applying the new one if directed. Removing the old patch prevents unintended extra dosing when the medication is delivered through the skin. Irritated sites, cutting patches, or adding heat may change absorption and increase adverse effects.